Hello, doctor. Could you please introduce yourself?
Yes, this is Professor Dr. Mohamed Saad Hamed, Professor of Internal Medicine and Endocrinology at Shams University.
Welcome, doctor. Doctor, can you tell us about your talk?
Yes, my talk was declaring that is the complications of diabetes is not only caused by a hyperglycemia or increased level of glucose in blood, but it's also there is many other factors that affect the complications right now. One of them is the duration of the disease. The earlier the disease discovery and the treatment is enough to reduce the complications. Of course, all of us know the complication which affect every cell of the body, because the disease of diabetes is a general disease. The only disease that affect all the vascular system, all the size of the arteries and venue and veins. That's to say, every cell can be affected. The brain cells, the kidney cells, the heart cells, the nervous cells, I mean the nerve cells, and the liver cell, kidney cells, everything can be affected because it depends on the nourishment of these cells via glucose and the oxygen. And the delivery of oxygen and the glucose, of course, is coming through the vascular system. This vascular system is affected hardly and negatively by the effect of hyperglycemia. The hyperglycemia, I mean, the increased level of glucose. The increased level of glucose, it is, as I mentioned, means an increase value of the measured glucose in the blood, which is normal between 80 milligram to 110 milligram during fasting. If it is post meal or post prandial or after meals by 2 hours, it's around 140, less than 140, but 140 to 200, it is in the gray zone. Could be and couldn't be, or going to be treated in the near future. In order to prevent these complications, because diabetes is a disease of complication, diabetes by its own, it's a chronic elevation or a long-standing elevation of blood glucose within the blood. But it means nothing. But its complication is the burden of the body. If there is, for example, a long-standing hyperglycemia and increased level of glucose for many years without complications, the patient can survive like anybody else. But the problem is complication, different from, for example, renal failure, different from the heart failure, different from other endocrine disorder. So the disturbance of diabetes, which is hyperglycemia, means nothing. But the complication, how we prevent the complication? Not only to stabilize and normalize the blood glucose level in blood, which is good target, of course, and we should work on it, but meanwhile we should prevent the fluctuation of the different readings of glucose within the blood during a fasting state or post-prandial state or after meal state. If it is, normalized or maybe homogeneous levels or nearly homogeneous, not the spikes of high levels and spikes of low level, this affects the brain tissue. It affects other vital tissue and precious tissue like kidney tissue, like nervous tissue, like heart tissue, and this after a while it will be complicated by heart failure, for example, by dementia, slow cerebration, bad memory, and the renal failure if it is persistent and not treated well as early as possible.
Thank you, doctor.